Your activity restrictions after your low back surgery are difficult to give with great confidence. And the reason why is that I'm not there to tell you that that's okay and that's not. You have to use some common sense here. I'm going to give you some basic guidelines to follow. For example, when you bend down, try and square up to the object that you're going to bend down to and bend your knees and go down and get it. I don't want you lifting more than about 15 or 20 pounds and try and keep it close to your body. Any weight out in front of yourself or to the sides causes torsion of your back and will cause low back pain. One of the most common questions after low back surgery is in regards to driving. Clearly, if you're on narcotics or muscle relaxants, you're not safe to drive, and you can't drive within 12 hours of taking either of those medications. If you're not taking those medicines, then you're legal to drive. Just be careful, especially getting in and out of the seat. Just go slowly and rotate over carefully, and you're probably okay from that standpoint. My patients usually tell me that they have to get out a little bit more frequently than usual just to walk around the cars and stretch. It's okay to drive on the anti-inflammatory medicines, however. The medications that I'll send you home on will include anti-inflammatory medicines, muscle relaxants, and also narcotics. You will be on anti-inflammatory medicines probably for a couple of months. We'll wean you off those over time. They're the baseline of diminishing the amount of inflammation that's causing your low back pain. Muscle relaxants will also be used. I try and give you the least sedating of all of those, but all of them cause sedation, so you really can't drive on them and you have to be careful. Most patients like them for about a week or so, but understand that they can make you very drowsy and kind of goofy, and I don't want you to get hooked on them to help you sleep at night. Generally speaking, I won't be refilling your muscle relaxants. Low back surgery can be a very painful experience. There are things that I do that are unique to me to diminish your pain level. I'm board certified in pain, and I will use some of those techniques to drop your pain. Most of the time, we can get away with you using narcotics for a very brief period of time, and I will send you home on narcotics. I don't want you taking them, however, unless you're really hurting quite a bit. I'd rather have you have about a 5 out of 10 pain and be awake and alert and oriented than have a 0 out of 10 pain and falling all over yourself and hurting yourself. So although you'll go home with some narcotics, you'll notice that I am constantly trying to help you get off the narcotics. It's great for your care to get off of those narcotics.